If you're dealing with stubborn blood sugar issues, cholesterol problems, or digestive concerns that just won't budge despite your best efforts, well, what if I told you there's a natural compound that research shows can be effective at managing these issues, but with additional benefits for your heart, gut, and overall metabolic health? Well, today we're diving deep into berberine HCl, what I call nature's metabolic master. And by the end of this video, you'll understand why this ancient remedy is making waves in modern functional medicine. I'm Dr. Michael Bell, board-certified clinical nutritionist, and I've been helping patients reclaim their health naturally for over 2 decades. So what exactly is berberine? It's a bright yellow compound found in several plants that have been used medicinally for thousands of years. You'll find it in golden seal, barberry, Oregon grape, and Chinese gold thread. Traditional healers use these plants for everything from digestive issues to infections. But here's what makes this really exciting. Modern science has now validated through several clinical studies that berberine has some very unique benefits. When we talk about berberine HCl, we're specifically referring to the hydrochloride salt form, which is what makes it stable and bioavailable in supplement form. Now, I know some of you might be thinking, how can one compound do so many things? And that's a great question. The secret lies in berberine's ability to activate something called AMPK. Think of it like your body's master energy switch. When AMPK gets activated, it's like turning on a powerful metabolic reset button. This activation triggers a cascade of beneficial effects like better glucose uptake by your cells, improved insulin sensitivity, enhanced fat burning, and even positive changes to your gut microbiome. But here's what really caught my attention as a functional medicine practitioner. Berberine doesn't just treat symptoms, it addresses root causes at the cellular level. Now let's talk about what the research shows for blood sugar control, because this is where berberine really shines. In a landmark study published in the Journal of Metabolism, researchers compared berberine to metformin, the most commonly prescribed diabetes drug. And the results? Berberine was just as effective at lowering blood sugar and hemoglobin A1C levels. But here's the kicker. Berberine also improved cholesterol profiles, something metformin doesn't do. We're talking about a 35% reduction in triglycerides compared with just 13% with metformin. Now, I'm not saying stop taking your prescribed medications and never do that without working with your healthcare provider, but what this shows us is the incredible potential of natural compounds when used appropriately. Now, speaking of cardiovascular health, let's talk about how berberine supports your heart and blood vessels. Multiple studies show berberine can reduce total cholesterol, lower LDL cholesterol, decrease triglycerides, and even modestly increase HDL cholesterol. It does this by increasing the number of LDL receptors on your liver cells, which essentially helps your body clear more cholesterol from your bloodstream naturally. And I've seen patients reduce their cholesterol by 20 to 30% with berberine, especially when combined with the right lifestyle changes and other targeted nutrients. Now here's where it gets really interesting from a functional medicine perspective. Berberine's effects on gut health. Your gut microbiome plays a crucial role in everything from metabolism to immune function to mood. Berberine helps optimize this delicate ecosystem. Research shows berberine increases beneficial bacteria like Akkermansia and Lactobacillus, while reducing harmful microorganisms. It's like a natural rebalancing act for your digestive system. I've used berberine successfully with people suffering from SIBO, which is small intestinal bacterial overgrowth, and other digestive issues. Its antimicrobial properties are gentle yet effective. Now, before you run out and buy berberine, let's talk about some important considerations. Berberine is best taken 3 times daily with meals. Timing with meals is important because it helps with absorption and reduces potential digestive upset. Speaking of digestive upset, some people may experience mild gastrointestinal symptoms when starting berberine, which is why I recommend beginning with a lower dose and gradually increasing. Now, this is something also crucial. Berberine can interact with certain medications, particularly those metabolized by the liver. So if you're taking prescription drugs, especially for diabetes or blood pressure, you need to work with a qualified healthcare professional. This brings me to why I'm so passionate about functional medicine and personalized care. While berberine is incredibly powerful, it's not a magic bullet. The most successful outcomes I see happen when we take a comprehensive approach which addresses diet, lifestyle, stress management, and using targeted supplementation based on individual needs. This is why proper lab testing is so important. We need to know your baseline glucose levels, insulin sensitivity, lipid profiles, inflammatory markers, and even your microbiome status. I can't tell you how many patients have come to me saying they've tried everything, but when we dig deeper with comprehensive testing, we discover the specific imbalances that needed to be addressed. So let me share a case study, and don't worry, I have permission to share this anonymized example. Sarah, a 52-year-old executive, came to me with prediabetes, high cholesterol, and digestive issues. Her conventional doctor wanted to start her on metformin and a statin. So through comprehensive lab testing, we discovered she had insulin resistance, chronic inflammation, and intestinal dysbiosis. We implemented a targeted protocol including berberine, dietary changes, and stress management. 6 months later, her A1C dropped from 6.2 to 5.4, her cholesterol improved by 25%, and her digestive symptoms resolved completely. More importantly, she felt energetic and vibrant. Now, while berberine was certainly a part of Sarah's success, it worked best as part of a comprehensive strategy. Research shows that berberine works synergistically with other compounds. For example, combining with curcumin and chromium can enhance glucose metabolism, while pairing it with milk thistle can support liver function. This is why I often recommend berberine as part of a targeted formulation rather than as a standalone supplement. The whole becomes greater than the sum of its parts. So who should consider berberine? Well, it may be beneficial if you're dealing with prediabetes or type 2 diabetes, high cholesterol or triglycerides, metabolic syndrome, PCOS, or digestive issues like SIBO. If you're simply looking to optimize your health, it may be part of a proactive strategy. But remember, berberine isn't appropriate for everyone. Pregnant and breastfeeding women should avoid it, and anyone with serious medical conditions need professional guidance. This is why personalized lab testing is so crucial. You wouldn't drive across country without a map, so why would you try to optimize your health without knowing where you're starting from? At Vitality Integrative Wellness, we use comprehensive functional medicine lab testing panels that give you a complete picture of your metabolic health, not just basic blood sugar and cholesterol numbers. We look at insulin sensitivity, inflammatory markers, nutrient status, hormone levels, gut health markers, and genetic factors that might influence how you respond to different interventions. This allows us to create a personalized protocol that might include berberine along with other targeted nutrients, dietary recommendations, lifestyle modifications that are specific to your unique biochemistry. So let's recap what we've covered today. Berberine HCl is a powerful natural compound with impressive research backing its use for blood sugar control, cholesterol management, and gut health support. Like any intervention, it works best as part of a comprehensive, personalized approach that's based on your individual health status and needs. If you're ready to take control of your metabolic health and discover whether berberine might be right for you, I encourage you to start with proper testing. At Vitality, we offer comprehensive metabolic health assessments that can identify exactly what your body needs to function optimally. Click the link in the description below to schedule your initial consultation or call our office directly. We'll be happy to discuss your health goals and determine which lab panels will be most beneficial for your situation. Remember, health is your most valuable asset. Investing in understanding your body's unique needs is the first step towards lasting vitality and wellness. If you found this information helpful, please give this video a thumbs up and subscribe for more evidence-based natural health content. And don't forget to ring that notification bell so you never miss out on our latest videos. Until next time, remember that true health comes from your body's natural healing abilities and working with them, not against them. Take care.